Okay, so since you see that this whole clotting process is really a cascade in which one thing activates another, and it really is kind of a positive feedback loop until you form the clot. So what prevents the clot from spreading beyond the site of injury? So if I started a clot in an area and it just keeps going with this sort of, this activates this and this activates this, why doesn't it fill up the whole vessel? Well, one of the things is that the circulation is constantly carrying away the clotting factors. And the other thing is that, let's see, where is it? Fibrin, the clot itself, actually absorbs and inactivates thrombin. So there's a little negative feedback once you get enough of the fibrin. So it absorbs, I think it's shown right here. I don't think it's shown anywhere. So it absorbs and inactivates thrombin. So as you build up a whole bunch of fibrin, it's going to go, oh, the clot is here, and it's going to inactivate this guy right here, which is thrombin. In addition, there are always present anticoagulants circulating in the bloodstream, and they're always active. And so if at any one place you have more constantly active anticoagulants than not constantly active coagulants, then the anticoagulants win. So a lot of them are made, some of them are made by mast cells or basophils. There's antithrombin 2, there's heparin. Those are present in the bloodstream all along, and they're kind of also like hemming in the clot. So clotting will really only occur when the concentration of these activated coagulants exceeds the concentration of the anticoagulants. But remember, you're always carrying things away and bringing more anticoagulants. Okay, so a couple of clinical connections here. There are anti-clotting medications. A lot of times these are called blood thinners, but it doesn't really have to do with the viscosity of blood. So there is heparin, which can be administered clinically, exogenously. You also make it yourself. It is administered therapeutically to prevent clotting during surgery. It actually destroys thrombin. Okay, heparin destroys thrombin. It used to be used relatively commonly on IV locks, and now it's more likely to be saline, but I think they still use it on central lines. Maybe you guys can tell me. Then there are the blood thinners that people take as maintenance medications. Coumadin Warfarin, these are similar forms of dicumarol. What those are is vitamin K antagonists. So they block the effects of vitamin K, and therefore they lower prothrombin, and they are used to prevent abnormal clotting in someone with hypertension or valve replacement, any predisposition to strokes or heart attacks, but they will also prevent appropriate clotting. So you might bruise like crazy while you're taking those. And then because blood tends to clot when it's stable, when it's just sitting around, platelets like to congregate, so you kind of have to keep them moving. The question comes up, like, how, if I donate blood, does my blood not just clot in the bag? Well, if you can tie up the calcium ions, right, then you couldn't do the extrinsic pathway, and you couldn't do the intrinsic pathway, and you couldn't do the common pathway. So if you have a chemical that will tie up calcium ions, it will stop clotting from occurring. And one of those that they use to do that is EDTA. I don't know what they use in blood banks currently, but okay. And then what about inappropriate clotting? We know that occurs. This is the formation of a clot inside an unbroken blood vessel. This is an oopsie. Why do these occur? How can you prevent them? What predisposes you to them? So when a clot forms, it's called a thrombus. Thromb is always means clot. And the problem with clot formation is that if a clot is big enough, if like, again, the blood is flowing this direction and a clot forms here, it's going to cut off blood flow to anything downstream. And if that tissue is dependent on aerobic cellular respiration, the tissue, the cells there can die. So, most of your thrombi form in the deep veins of the legs because the blood flow back is slow and gravity is against them. They're low pressure. That doesn't go very quickly through. So most of them form in the deep veins of the legs where they do little damage, and most of them get broken down by anticoagulants. But if a clot breaks loose and doesn't get broken down and begins to flow through the bloodstream, it's called an embolus. It's not the only thing that can cause an embolus, but it's one of the things. And again, not necessarily problematic, especially if your vessels are nice and wide because you're super healthy and you don't eat a whole lot of cholesterol and you don't have diabetes, you exercise a lot. But if the embolus gets stuck in a heart blood vessel, in an artery or an arteriole, the LAD, the anterior interventricular artery, the widowmaker, if it gets stuck in those, then it can cause a heart attack, a myocardial infarction, because the cardiac muscle is absolute crap at aerobic cellular respiration and has really, really high energy needs. Or if it gets pumped to the brain, one of those little bitty arteries of the brain, and cuts off blood flow to an area of the brain that you don't have an alternate route to, then it can cause a cerebrovascular accident or a stroke. It's not the only thing that can cause a stroke, but it's one of the things. So what makes you clot inappropriately? Why would you clot if you didn't have a hole? Well, if the inner surfaces of your blood vessels are really lumpy, then you're more likely to catch a platelet. And when you catch a platelet, it thinks platelet party, platelet party, platelet party. It starts calling its friends, even if there's no hole. So rough inner surface of the blood vessel, like IV drug use, or even if it wasn't, even if it was medical IV drugs, over and over again are going to damage the vessel and make clots more likely. Atherosclerosis, which is fatty plaque formation primarily from cholesterol and also sugar in your diet, increases the risk. And when it lays down inside your blood vessels, it doesn't lay down smoothly. And atherosclerosis also increases with type 1 and type 2 diabetes. High blood pressure stretches your vessels and tends to scar them, and then they're lumpy on the inner surface. Infections resulting in scarring, stasis of blood, just being still for a really long time, like a 24-hour flight to wherever, allows for clotting factors to accumulate. So they ask you to get up and move around in the planes now. If you've got an immobilized patient and you're not exercising them, even if you are, they are at higher risk of inappropriate clotting than someone who's mobile. Now, this one has a question mark just because the data isn't super strong for it, but I'm going to tell you because it's not a negative thing that you would choose to do anyway. So antioxidants in your diet typically come from really eating very brightly colored foods, purples and reds, things like that. And they include vitamin C, vitamin E, beta carotene, and selenium. And you need them anyway because there are antioxidant benefits in other areas. But there's a decent body of work that suggests that the plaque formation that occurs on the inside of your vessels is because the LDL, the low density lipoprotein cholesterol, sticks, but only if it's oxidized. So if you eat In-N-Out burger, make sure you're eating some brightly colored fruits and vegetables as well. It may make the cholesterol less likely to stick. Even if it doesn't, brightly colored fruits and vegetables are good for you. And so antioxidants seem to help to prevent oxygen from oxidizing the lipids in the body, and therefore they stick to the walls. Okay, smoking. Smoking is a risk factor for thrombosis for two reasons. It raises blood pressure and it decreases some of your antioxidants. And then high levels of estrogen. So during pregnancy, your estrogen levels are higher. When they get above a certain level, they seem to make your platelets a little stickier, a little more likely to call their friends. So pregnancy is hard on your cardiovascular system. This is one of the ways that it's hard on your cardiovascular system. Or in the old days when birth control pills were first around, which is like, I don't know, late 60s or early 70s, birth control, the early stages of birth control had lots of estrogen, and so really predisposed women for blood clots, especially if they were combined with other factors like hypertension or smoking or anything like that. Now, still a really responsible gynecologist or OBGYN would probably assess risk factors before giving you oral contraceptives. For instance, I have a heart valve problem and an arrhythmia problem that predisposes me to clotting. I don't smoke, but every single time I go to the doctor, they ask me those questions before they want to compile those predispositions for clotting. Okay, and that's it for this set.